evening, guys. Thank you for coming on board and sharing this time with us. So today we're going to be looking at blue space and well-being and how that can affect our health. So we're going to look at what blue space is. We're then going to look at different impacts. And finally, we're going to look at how we can use this to help protect the NHS. So let's start. What is blue space? And I know this sounds very strange, but in research, there's no real clear definition of open space, yet alone blue space. So open space is classed as a natural space that holds value to us as human beings. An urban green space is a natural space where humans have impacted the design, creation, or maintenance of a space. And this can include natural services or natural settings such as street trees, but also can include blue spaces. Historically, we see blue spaces at the centre of developing urban areas, and this is a really good example for Bath and the Roman spas that are there. And today that will be classed as an urban blue space. In 2015, a new definition came about, defining blue space as a health-enabling place where water is at the centre of that specific environment. Let's just talk about some stats and figures here. In 2015, it was suggested that 600 billion euros a year is spent on mental health care within the EU member states. In 2017 to 2018, we see work-related stress or anxiety accounting for more than half of all work days lost in the UK. Between 2006 and 2016, we see the number of antidepressants prescribed doubling. Unfortunately, we see more than a quarter of adults being diagnosed with a mental health illness at some point in their life. Nearly 6% of people in the UK suffer from generalised anxiety disorder, 3% from depression, and 1 in 5 of us will experience suicidal thoughts at some point in our lives. Now, that was taken from a 2006 research paper. Unfortunately, I think these stats are further on the rise. So we now see a rise in holistic approaches to trying to overcome a lot of these issues facing the NHS. And this is due to the growing number of studies that state that physical activity and nature can aid mental health indicators. We see this by decreasing anxiety and stress, encouraging physical activity, and reducing social isolation. We also see aid in recovery from things such as hospital wards, where people that look out onto a green space or have access to a little green area recover a lot quicker than those without. So how does it all work? The first idea is the stress reduction theory. This proposes that contact with nature or views of natural settings can have a positive effect for those with high levels of stress by shifting them into a more positive emotional state, as people are innately predispositioned to find non-threatening natural stimuli relaxing. Exposure to this stimuli triggers a parasympathetic nervous system response, leading to a feeling of enhanced well-being and relaxation. The attention restoration theory suggests that involuntary attention given to interesting and rich stimuli in natural settings helps improve performance in cognitively demanding tasks. So involuntary attention is things that attract us automatically, like loud noises, quick movements. And directed attention is things that we give our efforts and attention to, work, things that we like. But this means that we're ignoring other stimuli that could try and steal our limited attention. Stress and overstimulation can reduce our capacity for directed attention, with studies showing that involuntary attention can be used as a mechanism for restoring directed attention. Involuntary attention, which is facilitated in natural environments, restores it and therefore improves cognitive performance. Now, these theories are both based on the idea of biophilia. The biophilia hypothesis was coined by Wilson in 1984, which is the idea that humans are innately drawn to life and lifelike processes. Both theories suggest that interaction with nature serves as a restorative function, but through different mechanisms. We see a vast amount of studies that demonstrate and prove the restorative responses associated with viewing or being in a green or a blue space. We see this in the reduction of blood pressure, lowering of heart rate, the lowering of the concentration of cortisol, which is the flight or fight hormone, greater parasympathetic nerve activity and lower sympathetic nerve activity. And this is especially seen when observing woodland, again, that green environment, compared to, say, a city environment. So another thing I like to mention is that open space is also included a lot of the time, and green and blue are generally molded together. So when I'm talking about this research, most of the time blue spaces are ingrained in that green space. So let's look at some current research. Where is this all taking place? So we start with the SOPHIE project. This is Seas, Oceans and Public Health in Europe. While oceans can benefit human health and boost well-being through recreation and relaxation, it can also pose a risk to human health through flooding and pollution. This complicated mix of threats and opportunities interact in a way that we don't fully understand yet. So SOPHIE is exploring these ideas in this emerging discipline that they have called Oceans and Human Health. They look at the health benefits. For example, they have shown that water-based recreation activities can cost or have an estimated value to society of approximately £176 million per year in England alone. They have about 54 initiatives looking at therapy and mental health and exercising near a blue space. And they also try to link with Blue Health, which I'll talk about in a minute, and try to extend to the rest of Europe, as it's not yet clear whether the same findings will apply in different regions with different blue spaces. They also try and look at policy change through the idea of European Commission's Blue Growth Strategy. So next, let's move on to Blue Health, and this is an initiative and the centre. So it's the European Centre for Environment and Human Health, and SOPHIE is actually ingrained and entwined with them. Their aim is to increase understanding of how urban blue spaces can affect people's well-being. The majority of Europe's population live in urban areas characterised by inland waterways and coastal margins. They combine large-scale surveys with localised intervention to understand the effects these environments might have on health. In July 2020, they revealed that visits to marine and coastal areas with high levels of biodiversity are associated with greater levels of calmness, relaxation, and revitalization compared to those without that status. They also have analysed and further researched the idea of coastal effect, which is the idea where the closer people are to the coast, the more active they are. They have found that living near the coast in 2019 was linked to significantly better mental health, particularly in lowest income households in that area. And this is all funded by the EU Horizon 2020 project, which is the biggest EU research innovation programme, with nearly 80 billion euros of funding available over 7 years. So it's going to be really interesting to see what these guys conclude with and whether or not they are granted further research as we have started 2021. And we do also tend to see the rise in publications. So this funding was between 2014 to now, and we tend to see the rise in literature within this area just almost double. It's really impressive. So we're now going to look at Itsuki, who is a phenomenal researcher, and I'm just going to play a little clip about what she does to help us understand a bit more. And basically she's looking at our interconnection with nature and the impact that we have on the waterways and sort of pollution and everything that we work for as marine scientists, but also what happens if we don't have that connection there for us as human beings and that impact that it can have. So she looks at systematic reviews of blue space to show that significant benefits to health, especially mental health and social well-being and social connectedness is a really big thing. And the reason that I have focused so much on her is because she shows a really interesting bridge between the research that we were just looking at between being happy in a natural environment and bringing those restorative effects. And she also is looking at surfing. So she's produced research on surfing in the senses, understanding the embodies and therapeutic experiences of young surfers with autism. And the reason I bring this up is because she is a cold water surf ambassador for Finisterre, a marine ambassador for the Eden Project International, and also a blue health ambassador for the Wave, which links really nicely with blue health and surf and how we can use surfing and being in the water to aid mental health. So surf therapy is currently being used to help people with physical disabilities and veterans with PTSD, young people with mental health problems, and women seeking to become more confident. There have been documented benefits, including fewer stresses caused by an urban environment, such as noise, pollution, and traffic. And it tends to be more conducive with physical activity compared to urban areas. People tend to want to do it more. As we already know that physical activity boosts well-being in the body. Etsky also discovered in 2018 that it may be easier to get along with people in natural aquatic environments. In 2010, the first surf therapy course was funded by the NHS, and this was the Wave Project. This originally started in Cornwall, and you can now find them all across the UK. So after their second ever session, all of their scores in confidence rose. So it started off as an average of 5.9. After the second session, it went to 8.6 to 10. Referrals from the scheme came from schools, doctors, social workers, and other child supporting agencies. Most of the children had never surfed before, but after, 70% of them continued to be members of surf clubs. Other studies showed that clients felt 96% better, 98% happier, 89% said that they made friends, and 87% said that they felt fitter. Meanwhile, 79% of parents said that this scheme helped their kids and aided them to have a more positive attitude. 62% said that they had better communication skills. 62% also reported children being more active. 56% thought that they showed a healthier lifestyle. And 46% of them could actually prove that their education had improved and progressed since joining the course. In 2017, the Wave Project joined 6 other surf therapy organisations from different countries to form an international surf therapy organisation to use surfing for social good, with findings being able to demonstrate a valuable and cost-effective way to deliver mental health care, to mentor and encourage social integration of young people. And the reason I talk about this so much and with such passion is we've got 3 different clips here, and I'm not going to play them. As I said, I will either link them underneath the YouTube clip that will come up, or we can have the PowerPoint sent out to you guys. So the first one in the corner here is a Red Bull documentary about 7 minutes long. And this is a project called Ways for Change. And this is a child-friendly mental health service for at-risk youth living in unsustainable communities. And this is also by a guy called Apish, who is also a Finisterre ambassador, just like Etsky is. So they are using, Finisterre especially, are using their sustainable platform to encourage mental health awareness and also what communities can do about it. The one next to it in the top right-hand corner is a little 2-minute clip by Etsky focusing on nature connectedness and how surfing can impact and aid that, or just being in water. And the one below is a documentary called Resurface, which I highly recommend watching. And this focuses on veterans with PTSD, mainly in America. And if you go down the American route, you can also read the book by Dr. Wallace Nicholas called Blue Mind, which is also incredible. And this really touches on how helpful and cost effective it can be in terms of looking at drug use and antidepressants compared to using the natural environment. This all links together with a guy called Jamie Marshall, who is the first ever PhD student to be studying surf therapy and proving the benefits. And the reason I've talked so much about surf therapy is there is so much research supporting the benefits of it that we could definitely be using it as a cost-effective way to help and reduce the strain on the NHS with the inevitable rise of mental health disorders, and also, unfortunately, other impacts that we're seeing, especially with the rise of things like diabetes. I'd just like to thank everybody for listening and open up the questions and comment sections to just discuss what they feel, whether they think this is a really good idea, or anything else they want to comment.
Thank you so much for that. That was super interesting. I believe there's also an ongoing project where they're doing surfing with refugee girls to increase their self-esteem. And I think that's, it's just amazing. Just amazing what they do and how it's such an easy, like you say, I mean, it's easy, it's cost effective. And it's surprising. I think many people still think of surfing as something, that's just something that these long-haired dudes do. And I think it still has a bit of that stigma of, you like, it's just hanging out at the beach and maybe smoking some weed. And, from time to time, you just like surf and then you're like, so I think there's actually I guess these guys sometimes have to fight against the stigma, and it's great to see that they're actually moving into this sphere of being recognized for how helpful it can be.
Definitely, and it's not just surfing. There are lots of documented reports of things like wild swimming and cold water shock therapy swimming and the benefits it can have. It's really about just being in the water. So a lot of the time, especially for the WAVE project, some of the students never even get in the water. Some of them might just stand with their feet in the water, but it's having that safe space. And I think that's something that the surfing community especially is very, very good at producing, is a safe, inclusive environment to allow people to unload, basically. And it's working. It's working across the world, and the International Federation is now allowing and collecting data to prove this, and it works so nicely in conjunction with the stats and research that the other areas are producing, especially people like Sophie. So the NHS have started prescribing green prescriptions. I'm not sure whether they're prescribing blue yet, but they have also funded the WAVE project, and that's how they first initially started. So I think they will probably continue to do so if they have the stats to prove it. I can't see any reason why they wouldn't.
Great. Well, our hour is up. So thanks a lot for that great conversation.